Hi, this is Christine with Sanford Pelvic Therapy. We're going to be doing some stretching for your hip flexors, postpartum. This is going to feel really great. We get real tight hip flexors from sitting so long during the day, taking care of babies and feeding babies, and also from the changes in our pelvic posture during pregnancy. So this is a nice way to open that up. Very gentle. All right. We're going to be lying down on the floor. I like to have a little pillow if you want one. And one leg is going to be down and the other leg is going to be pulling towards your chest. So you might get a little stretch here too, but what we're focusing on is this muscles right here. You might have enough tightness that just being in this position feels like a stretch, and that is great and just fine. This leg up here, you can have it in whatever position feels comfortable for your hip. Okay. Sometimes postpartum, or if we have hip restrictions for other reasons, we might feel like a little compression or pressure here. So you'll just find where's the most comfortable for you. All right. If you want a little more stretch, you're going to use a little towel roll or a really small pillow, and you're going to tilt your pelvis a little bit with that. So you're going to put it under the bottom part of your hips right here, under your sacrum, and that's going to give a little posterior pelvic tilt. I think I want a little bit more. Right? So it's making my pelvis fall back in that direction. Okay? You don't have to have that if you have plenty of stretch without it. But if you feel like you need a little more stretch, that is great too. It gives your legs a little more space there. All right, now what we're going to do with this leg is we're going to be thinking about squeezing your glute and reaching long, like pushing down into your heel. And that's going to help open up this hip. Okay, so we're going to do that. Squeeze that glute, reach along with that leg. Take a breath here. And then give it a break. Okay, great. Again, we're squeezing this glute on this side right here and reaching along with your leg. Okay, so we're not pointing. We're going to be like pushing down with the heel, meaning pushing down towards your feet, not down towards the floor. We're not trying to use our leg to push us like this. Okay, we're reaching down towards your heel. At the same time, you're squeezing this glute. Okay, that's going to help open that hip up. Be here, squeeze the glute, reach down, take a nice breath here. Another breath. Good, and relax. It's going to get these glutes back online too, because they get kind of lazy during pregnancy with our postural changes. Our hips are just kind of slid forward a little bit, and our glutes are tucked under, but they're not very active. And a lot of people complain about getting a squishy booty during pregnancy, and that's one of the reasons why. So this is a nice way to get your glutes firing again. All right. So we're going to pull this leg up. The other leg, we're going to be squeezing the glute, reaching down into the heel. Take a couple breaths there. Really squeeze that glute. Good. And then take a little break. Right? I would do that a few times on each leg, or just set a timer for about 3 to 5 minutes and go back and forth.